I've been a GP for 13 years, and I think it's fair to say that general practice has changed unrecognisably just in that short period of time. So when I first qualified, I would expect the majority of my patients to come in with a pain or a rash or a complaint. Whereas today, the majority of my patients will be coming in for a review, or I will have called them in for a health check, or they have come spontaneously for a health check. So there is a subtle but very important change from being, if you like, what was an ILF service to now being a health service, and we're doing a lot more preventative medicine. We are also doing a lot more in general practice that was just 13 years ago done in hospitals. So if you were diabetic, for example, 10, 15 years ago, the vast majority of your care would have been done by specialists and specialist nurses in the hospital setting. Today, provided you don't have anything too horrendous, the vast majority of your care will be done in your own surgery, and possibly not actually even by your own GP, but by a specialist nurse within that surgery. When I qualified as a GP in 1996, as far as I was concerned, I had signed up at that stage to working on call every Thursday night and every fourth weekend, and that basically meant working from 8:30 a.m. on a Friday morning right through till 6:30 or 7 p.m. even on a Monday night. That has changed unrecognisably in really what is a very short period of time. And today, a GP who is qualifying today would not be expected routinely to do out of hours. I choose to still opt in, if you like, so I volunteer to do some sessions out of hours in our local cooperative, and I do that because for me it's very important to stay in touch with emergency care, but it's not a prerequisite anymore. There's no doubt that general practice is more proactive, I think, today than it was even just a decade ago. So rather than reacting to health problems, we spend a lot more time today looking for things that could become problems in the future if we didn't act. So checking your blood pressure, checking your cholesterol, measuring your body mass index, giving you the kind of information that you need to prevent becoming ill in the future. Patients are undoubtedly more informed today, I think, than ever before. It's not that long ago that it wouldn't be unusual for me to meet someone. For example, I can think of a lady who had a huge scar on her back, and I remember saying to her, "So what happened there?" And she said, "Oh, they took my kidney out, dear." And I said, "Why did they do that?" And she said, "I don't know, they just said it was bad." Now, that is absolutely unheard of, I hope, in the NHS of today. But it's not that long ago that I think people just accepted what the doctor said, and they did as they were told. And I'm very pleased to say that today we are much more in liaison with the patient, if you like. Patients are much better informed. Most doctors are much happier to involve the patient in their decision-making process. But with that does come a caveat, and I think with choice can come confusion. And every week I see people who have rocked up to surgery with a wodge of paper they've printed off the internet, convinced that they've got something desperately rare and that they're going to be dead by the weekend. And I think it's really important that we help people to know where to go. You know, we've got choice coming out of our ears now. We've got the website, we've got NHS Direct, we've got your GP, your practice nurse, casualty, 999. I mean, where do you stop? And where do you go for the information that's relevant to you? So I think we've got a long way to go in making sure that we give patients direction, if you like, on where to go for their health information. The internet is a fantastic source of health information. There is no question about that. The problem for the public can be knowing what is reliable information and what isn't, and of course unreliable information is very harmful. So it's very important that the public know and that we help them to access reliable information. I think it's absolutely critical for a doctor to keep up to date. There is no question about that. And how you keep up to date is obviously a slightly personal thing. For me, I use a lot of the internet. I have certain sites that I trust. I know that they're reliable and I know they're up to date. I also attend regular meetings that our health authority arrange, that the Postgraduate Centre do. I receive the British Medical Journal and various different GP publications, which obviously also keep me up to date. And also with my media hat on, I'm probably doubly lucky because I do receive a lot of press releases, so I find it quite easy therefore to keep up to date. But I think it's really, really important if you go and see a doctor or a car mechanic or a vet or a dentist, what you want to know is that they are giving you 21st century service. You don't want 20th century service from them. When I first qualified in general practice, I had done quite a lot of hospital jobs. I'd worked a lot in intensive care, cardiology, in renal medicine. When I joined general practice, I was the only female partner in a 7-doctor practice, and so actually very quickly it became obvious to me that I was going to need to know a bit about women's health, because a lot of women do choose to see a female doctor about female health issues. So I spent quite a bit of time actually doing some extra clinics and becoming more qualified in that field, and it has become a lifelong passion, if you like. I now work with 2 or 3 other female doctors, but I still very much enjoy women's health. And as a knock-on from that, obviously if a lady comes to see a particular doctor and gets on, then when her child is poorly, the chances are that they will bring their child to that same person. So family health has also become a big interest of mine, probably also helped by the fact that I've got 3 of my own kids. So I think it's been something that A, I'm interested in, but B, I can talk with some degree of empathy with parents. And I guess my other big passion, it has to be weight management, and that's because I feel very passionately about the NHS, but I think that the one thing that could bring our National Health Service to its knees is obesity. Most of us know that being overweight or being obese will increase your risks of things like diabetes and heart disease, but it's not just that. Being obese increases your risks of being depressed, of having certain cancers, of developing arthritis, and all those things potentially cost the NHS a lot of money. For me, I believe that the cost implications of allowing someone to continue through life obese are abhorrent, and we ought to be doing anything and everything that we can to help these people alter their lifestyles. It's not easy. Most obese people have tried every diet in the book, and they have yo-yoed and yo-yoed, and I'm a great believer that the way forward for these people is with weight management clinics where we can look into the psychology of their relationship with food, their exercise regimes. It's no good telling these people to go to a gym and mix with Body Beautiful. You know, they will try. They really do want to work. They will try, and they might be doing it in a week. They might still be doing it in a month. They almost certainly won't be doing it in a year's time. So it's important that we give people the right tools, and for some people that will mean surgery. We live today in a very media-savvy society, and whether we like it or not, a lot of the British public rely on the media for their healthcare information. So I think rather than trying to battle that, we're not going to win that battle, let's embrace it. And I know that a lot of my mailbag with my media doctor hat on is from people who perhaps want that anonymity. There is a lot of thirst out there for knowledge about healthcare issues. One of the things I've learnt from working on embarrassing bodies is just how big a hurdle embarrassment is. And I can tell you, for example, I mean, I think I'm a fairly approachable GP. A lot of my patients call me Dawn. I hope I'm not judgmental, and I hope that I involve patients in their choices and in their treatment. But I have met a significant number of my patients since embarrassing bodies who have made an appointment to come and see me because they've been struggling with a problem that they saw on embarrassing bodies and have then come to see me about it. Now, they knew me before, they had every opportunity to talk to me before, but it was that green ticket that a television programme gave them. And I think that's something we, you know, certainly I have learnt a real lesson in that, and I think that we need to embrace that, and we need to use television, use radio, use the internet. They are all great sources of information for our public. Whatever you've got, you're not on your own. Whatever you've got, your doctor isn't going to laugh at you. And whatever you've got, we can do something about it. And I think those messages have come over very loud and clear in the series and online. And I have seen plenty of patients come through my door who knew me before, but have come and seen me. I was at a dinner not that long ago, 60 doctors, and my colleagues, I can tell you, do tease me incessantly about my media life. And of those 60 doctors in that room, at the time, Teen Bodies was airing. And of those 60 doctors, I would say at least 40 of them came to see me because they had seen a patient in the last week or fortnight who had either watched the programme or been online and made an appointment as a result. I mean, I think that says it all, really. The internet is here to stay. Utopia for me would be to have one really reliable site that my patients would access information at a level that was useful for them, but that I could also access and that actually would be used by the whole profession. So right from the consultant at the top of his tree at the tertiary referral centre, through local consultants, paramedics, physiotherapists, GPs, and the nurses. And if we were all accessing the same site, but accessing information at a level that was relevant to us, then we'd have a really good chance of all singing from the same song sheet and then avoiding the confusion that I think can exist in healthcare. I'm really proud of our National Health Service. I think we all should be. But, as with everything, there is always room for improvement. And the one thing, if I could change, would be to allow more time for the individual. And I think, you know, your average GP appointment today is 5 or 10 minutes. And that is a really very short amount of time for you to tell me what's wrong with you, for me to examine the relevant part of your body, explain to you what I think is going on and what we're going to do in the future. And on top of that, today, probably try and also practice some preventative medicine. So maybe take your blood pressure, perhaps talk to you about booking in for a smear, maybe arrange for you to have a cholesterol test. That is a very short period of time, and my absolute dream, I guess, would be to double the appointment time in general practice.